You know what's really uncomfortable, but most people have never heard of it?
What is it?
A peritonsillar abscess.
Oh, that's a mouthful, literally.
Haha, exactly. It's like when a sore throat decides to take things up a
Right.
notch. You start with tonsillitis, and then it can escalate into this painful collection of pus near your tonsils.
That sounds nasty. So it's worse than regular tonsillitis?
Oh, absolutely. It's like your throat is hoarding all the bad stuff.
Mm-hmm.
And not only does it hurt to swallow, but speaking and even breathing can become difficult.
Wow, breathing too? That's serious?
Yeah, it's not something to take lightly. The abscess can cause swelling that blocks the throat.
Yeah. So what causes this peritonsillar abscess in the first place?
Well, it's often a complication of tonsillitis. The same bacteria that cause strep throat, streptococcal bacteria, can lead to
Okay.
it. Then anaerobic bacteria join the party, making things worse.
Are there risk factors we should be aware of?
Definitely. Smoking is a big one.
Right.
Also, chronic tonsillitis, infectious mononucleosis, dental infections can increase the risk.
So taking care of your teeth could actually prevent this?
Exactly. Good oral hygiene isn't just about a pretty smile.
Yep. But wait, I thought peritonsillar abscesses were mainly due to tonsillitis, not dental issues.
Well, you're right that tonsillitis is a major cause, but dental infections can also be a risk factor. It's all connected
got
in
it.
the oral cavity.
Makes sense. So what symptoms should people look out for?
Well, it usually starts with a sore throat. Then you might notice fever, painful swallowing, swollen glands, and a muffled voice.
Wait, a muffled voice?
Yeah, it's often described as a hot potato voice,
Haha,
like you're trying to talk with a hot potato in your mouth.
that's quite the image.
I know, right? It's not pleasant. If someone experiences these symptoms, especially difficulty swallowing or breathing, they should seek medical attention immediately.
So no home remedies for this one?
No, unfortunately not. There's no home treatment.
Mm-hmm. So how do doctors treat it?
Usually they need to drain the abscess. They might use a needle aspiration or make a small incision. And antibiotics are a must.
Sounds painful. Do they use anesthesia?
Yes, they'll use a local anesthetic.
Hmm.
And if necessary, they can give pain medication through an IV.
That's a relief. So can it come back?
If you don't have chronic tonsillitis, it's unlikely. Only about a 10% chance of recurrence.
That's good to know.
But it's important to follow up with your doctor and finish all prescribed antibiotics.
Right. Absolutely. So prevention is key, right?
Yes, and while there's no guaranteed way to prevent it, not smoking, maintaining good dental hygiene, and treating oral infections promptly can help.
You know, I didn't realize smoking could affect throat infections like that.
It's surprising how interconnected everything is. Smoking can compromise your immune system, making infections more likely.
Yeah, that's another good reason to quit.
Exactly. Your throat will thank you.
So bottom line is, if you have a sore throat that's getting worse, get it checked out.
Absolutely. Early treatment can prevent complications.
Good to know. Thanks for shedding light on this.